If you don't understand the language, you will never understand medical billing. Most beginners do not fail because the work is difficult, but because the terms confuse them. Words like claim, deductible, copay, denial, they hear them again and again, but they never truly understand them. And when you don't understand the words, every step feels complicated. This is lesson 4 of my complete medical billing series, and in this video, I will explain the most important medical billing terminologies in such a clear and simple way so you never feel confused again. Before we move into practical work, we need to build your vocabulary. Think of this as learning the language of medical billing. Because in the coming videos, I will use these terms again and again. If you understand them now, everything will feel easy later. If you skip them, you will feel confused again and again. So don't rush this video, focus, understand, and build your foundation strong. Before we start the terms, understand one simple idea. Every term in medical billing is connected to the one goal, getting the provider paid correctly. Some terms are related to the patient, some to the insurance, and some to the payment process. So don't try to memorize words like definitions, instead understand where they fit in the system. Once you understand that, everything becomes logical. The patient is the starting point of the entire process. The patient is the person who receives medical treatment. But from a billing perspective, the patient is not just someone who gets treated. The patient is also the source of all the information. Their name, date of birth, insurance details, and visit information, everything starts from them. Now, here is something very important. In the United States, most patients do not pay full cash for their treatment. Instead, they rely on insurance. This means the patient becomes part of a bigger financial system. If the patient provides incorrect information, the entire billing process can fail. So even though the patient is not directly involved in billing work, their information controls everything. The provider is a person or organization that gives medical services. This can be a doctor, nurse, clinic, hospital, or any healthcare facility. But from a billing perspective, the provider has two important roles. First, they treat the patient. Second, they document everything. This documentation includes what service was provided, what procedure was done, and what diagnosis was made. This is extremely important because billing does not happen based on memory, it happens based on documentation. If the provider's documentation is incomplete, the claim can be rejected. So you can think of the provider as a source of both treatment and billing data. The insurance company, also called the payer, is the one who pays the bill. But they do not pay randomly. They follow strict rules and policies. The patient pays a fixed amount every month to the insurance company, which is called a premium. In return, the insurance company agrees to cover certain medical expenses. When a claim is sent, the insurance company reviews it carefully. They check if the service is covered, if the information is correct, and if the rules are followed. Based on this, they decide how much to pay. They may pay the full amount, partially pay, or deny the claim. A claim is the most important document in medical billing. A claim is simply a request for payment sent to the insurance company. But it is not just a simple request. It contains detailed information such as patient details, provider information, services provided, and medical codes. You can think of it like an official invoice, but in a structured format that insurance companies understand. If the claim is accurate and complete, payment is processed smoothly. But if there is even a small mistake, the claim can be denied. So as a medical biller, your main job is to create clean and error-free claims. Premium is the amount the patient pays to the insurance company regularly, usually every month. You can think of it like a subscription fee. Just like you pay for internet or a mobile package, the patient pays the insurance company to keep their coverage active. If the patient stops paying the premium, their insurance can become inactive. And if insurance is inactive, the claim will not be paid. So premium is what keeps the insurance system running. Copay is a fixed amount that the patient pays at the time of the visit. For example, if a patient has a $20 copay, they must pay that amount when they visit the doctor. The rest of the bill is handled by the insurance company. Copay is important because it reduces the burden on the insurance company and ensures the patient shares some cost. As a biller, you need to know that part of the payment may already be collected from the patient through copay. Deductible is one of the most confusing terms for beginners, but it is actually very simple. Deductible is the amount the patient must pay out of their own pocket before the insurance company starts paying. For example, if a patient has a $500 deductible, they must pay the first $500 of their medical expenses themselves. After that, the insurance company starts contributing. So, until the deductible is met, insurance will not pay. This is why some claims are not paid even when insurance is active. Coinsurance comes into play after the deductible is met. It is the percentage of the bill that the patient has to pay. For example, if the insurance covers 80% of the bill, the remaining 20% is paid by the patient. That 20% is called coinsurance. So even after insurance starts paying, the patient may still have a share of the cost. Eligibility means checking whether the patient's insurance is active and what services are covered. This step is done before treatment to avoid problems later. It confirms whether the patient is eligible for benefits. If eligibility is not verified properly, the claim can be denied or the patient may receive an unexpected bill. So this step protects both the provider and the patient. Claim submission is the process of sending the claim to the insurance company. This is usually done electronically through a clearinghouse. Once the claim is submitted, it enters the insurance system for review. This step must be done carefully because once the claim is sent, any error can lead to delay or denial. Adjudication is the process where the insurance company reviews the claim. They check everything in detail, whether the service is covered, whether the codes are correct, and whether the rules are followed. After reviewing, they decide whether to approve, partially pay, or deny the claim. This is the decision-making stage. Reimbursement simply means payment. When the insurance company approves a claim and sends money to the provider, that payment is called reimbursement. This is the final goal of the entire billing process. Denial is when the insurance company refuses to pay a claim. This can happen due to errors, missing information, or policy rules. But denial does not mean the process is over. It means something needs to be corrected. A good biller analyzes the reason for denial and fixes it. Accounts receivable or AR refers to all the money that is still pending. These are claims that have been submitted but not yet paid. As a biller, you track these claims and follow up to ensure payment is received. This step is important because delayed claims mean delayed revenue. EOB or explanation of benefits is a document sent by the insurance company after processing a claim. It explains how much was billed, how much was paid, and how much is patient responsibility and why any amount was not paid. It gives a complete breakdown of the decision. ERA or Electronic Remittance Advice is the electronic version of EOB. It contains the same payment details, but it received digitally, and it allows billers to post payments quickly and accurately in the system. Now let's bring everything together. A patient visits a provider and provides insurance information. Eligibility is checked. The provider gives treatment and creates documentation. A claim is created and submitted. The insurance company reviews it through adjudication. If approved, reimbursement is sent. If denied, it is corrected and resubmitted. Any pending claims are tracked in accounts receivable, and all payment details are provided through EOB or ERA. This is how all these terms connect into one system. Now you don't just know these terms, you understand them. This is the language of medical billing. And because you understand this language, every upcoming topic will feel easier and clearer. If you are serious about mastering medical billing, subscribe to the channel and turn on notifications. In the next video, we will discuss the difference between medical billing and medical coding. You don't want to miss that.